All right, thanks everyone for joining. We have two wonderful guests, Sister Vicky Ho and Brother Alex Pan with us. They work professionally in this area, and for the majority of this time, I'm going to pass it over to them. So just so everyone knows, the structure of this time is going to be first spent with Vicky and Alex speaking to us directly on a variety of topics, and then the last bit of time will be devoted towards Q&A. So if you have questions, please save it for the end, and I'll be fielding the questions. So if anyone has questions, please send them please chat me directly or put them in the chat to everyone, and I'll compile a list and kind of moderate the question and answer session at the end. So I'm just gonna pass it on to Vicky and Alex. I'm gonna let them introduce themselves and then speak what they have prepared.
Amen. Well, hi, dear saints. It's good to be with you. Just wanted to take a moment to just introduce ourselves a little bit and our experience in this area of mental health. I myself am a pediatric psychologist and clinical supervisor at Children's Hospital of Orange County here in Orange, California. And my specialty is pediatric neuropsychology, so I work mostly with children and teenagers with various kinds of brain disorders. But I also maintain a private practice here in Orange County, and I hold a few various leadership positions in the field, including the American Psychological Association. So this is just kind of a little bit about my experience in the field. Vicky?
Yeah. Hi, Saints. My name is Vicky Ho, and I just added my credentials there at the bottom so you can see it. I'm a licensed marriage and family therapist. So that means I have a master's, a clinical master's in marriage and family therapy, and I primarily practice in a private practice, working with generally young adult individuals as well as couples. In improving relational quality and satisfaction, and also dealing with issues such as addiction, trauma, family of origin issues. So I've been licensed just recently and came into the mental health field after years of serving here in the church in Los Angeles, primarily with our young people, college students, and afterwards. So really realizing there was a need for this kind of training, and the kind of being a doorway to help the saints learn more about this and get the help that they need. So.
Amen. Thanks, Vicky, for your credentials. I renamed mine as well to add mine. And so, dear parents and serving ones, I believe that's who's in the audience today. Vicky and I just wanted to share a few points, and then we hope to save a good amount of time to give you the chance to ask questions, particularly while you have two mental health professionals in the room. We're very burdened about this topic of mental health. Certainly, Vicky and I, being in the field, have a certain perspective. But the way that I typically define mental health is just the well-being of our soul, and it's three parts, right? Our mind, emotion, and will. And that kind of represents in the field the healthy functioning of our thoughts, our emotions, and our behaviors. And of course, we know that the Lord cares very much about the condition of our soul. He's the shepherd and overseer of our souls. And in 1 Thessalonians, it says that that may our spirit and soul and body be preserved complete. So he's quite invested in the condition and well-being of our entire being and the entire beings of our young people. And so I think there's really a burden here because in recent years, the churches have encountered an increasing frequency of mental health problems, even some tragic complications and the loss of some of our own that really emphasize the need for this burden to really penetrate the Lord's recovery. And so this is no different than the trends that we are seeing in society. Of course, as as the Lord is carrying out his economy, the enemy's attack intensifies. And we see this not just among the saints, but in society as well, in our professional work. And superimposed on this is, in the past year, of course, a national, international pandemic, and which has really, across our professional and personal experience, really had a negative impact on the mental health of not just our children and young people, but our adults as well. And so, in introducing this topic, I think I just want to express, as adults, as parents, as serving ones, if there's any experience you can empathize with, it's probably going to be mental health difficulties. It's estimated that before the pandemic, that 1 in every 5 adults experiences mental illness at any given time, and that 50% of all individuals will experience a mental illness at some point in their lifetime. So that's 1 in every 2 people. So that means between you and your spouse, between you and your child, between you and your companion, it's likely that one of you may be struggling with this now, or have struggled with this in the past, or will struggle with this in the future. And if not, then I can almost guarantee that you will need to shepherd someone or care for someone that's going through difficulties that have become significant enough that it would warrant mental health concern. And so I want to share just a few statistics with you related especially to our young people. Prior to the pandemic, we had 1 in every 5 young people having a diagnosable mental illness. Among young people, we had 1 in every 4 females and 1 in every 10 males engaging in some kind of self-injury behaviors, most commonly cutting. We had 19%, so almost a fifth of our young people seriously contemplating suicide, with 9%, so almost 1/10 going on to have a suicide attempt. And in our young people and college age groups combined, suicide has become the second leading, or is the second leading cause of death after accidents. So the first leading cause being, some kind of accident, typically a motor vehicle accident or other kind of situation like that. And then the second leading cause after that is someone taking their own life. And so this was prior to the pandemic. These numbers have gone up since then. Nationally, what we're seeing in the field is that in the months after the pandemic started, we had 4 times the rate of depression, 3 times the rate of anxiety, and 2 times the rate of suicide risk among our adolescent age groups. And to speak specifically in Orange County, I think maybe not everyone here is in Southern California, but just given my position within the Orange County healthcare system, we're seeing some trends locally as well. Before the pandemic, in the last decade, so since 2010, we've had a 76% increase in mental health hospitalizations in Orange County. 32% increase in emergency department visits related to self-harm, and a 45% increase in teen suicide. In the months after the pandemic started, in Orange County specifically, we had our crisis line contact in both Orange and LA counties increased 8,000%. At Chalk Hospital, so Children's Hospital of Orange County, our requests for our outpatient mental health services increased by 122%. And what was typically about 20% of those needing to be escalated to higher level care because of significant concerns related to either self-harm or suicide, after the pandemic, that percentage went up to 60%. So I tell you these statistics, dear saints, not to discourage you, but to impress you with the level of attack that our young people are facing, specifically in this area.
Mhm.
And why has the pandemic created such an effect? Well, with our young people, they are navigating two big psychological problems. One is feelings of worthlessness, which we can see in how much our young people care about their identity, right? Their identity on social media, their identity in their social circles, what they put their worth in. Um, and then the second biggest problem that we see is isolation. And especially as they transition on to college age and young adults, we have significant concerns with who our friends are, being in relationships, um, and for our, college age, what organizations we would join to surround ourselves with community, and even the matter of dating and marriage. So, with these two big psychological problems, the pandemic certainly provided some fuel to that kind of fire. So, less chances to feel accomplishment, missing out on typical experiences, certainly leading to some um, increased difficulties with self worth. And then the increased social isolation, of course, from quarantine and addiction, perhaps to isolating activities such as video games or social media, um, would certainly add to this as well. So, dear Saints, if we are to be serving ones to this particular generation, especially at this particular time, if we're to be parents to our young people at this particular time, we need to advance in our awareness of this need and are being equipped to respond to this need. And so, before I pass it on to Vicky, I just want to mention that Lord's Day at 5 p.m., we will have a mental health session with our young people. But we would heavily encourage, if you're available, to attend. We will be kind of going over in an interactive way some mental health coping skills that Vicky and I actually use professionally with our patients and clients that we work with. And we feel it would just be a positive way for you as parents and serving ones to enter into the topic together with your children and with the ones you serve, to see how we work with young people and to provide a way even for you to communicate with them about the topic going forward. So I hope there's just some initial impression of the burden. Um, and I'm going to pass it along to Vicky to speak a little bit on the matter of professional help.
Yeah, thank you, Alex. So essentially, I think what Alex is talking about is that we ourselves and our children, or our young people in the churches, we're not immune to these things. We all have been experiencing the pandemic, and you know, especially for our young people, you know, spiritual resources are not necessarily what's going to provide something for them. For ourselves, maybe so, but for our young people who are not as developed or in the, growth in the divine life, they're very immature. In fact, this is not what we should be turning to. We really need to recognize that they may need help in their soul, in their emotional, mental, and well-being. And so we wanted to just address that it's okay to get help. I really liked the way Alex said that, I think it was, I forget, 1 in 5, 50-50, that basically there is these statistics show that we all potentially will or need to shepherd someone who is going through experiencing a mental illness. And so I would emphasize that, to experience mental illness is not the same thing as being mentally ill, as identifying as a mentally ill person. That's different. So given the current stressors that we've all been going through in such an extended period, so unexpected, and having this experience of stressors and maybe naming it as experiencing a mental illness, that may feel scary, but in actuality, that's life. This is like part of human life, is that it can be very stressful, and there may be times when we and or our children need help, need professional help. Just like, um, for example, my son, like a few weeks ago, had a very severe stomach ache. And partly, as a parent, I was like, it's a stomach ache, okay, we'll just kind of wait it out. But after, a day and a half of a severe stomach ache, I was like, yeah, it's time. I don't know where to press. I don't know, what questions to ask to determine is this severe or not. But he's telling me he has a severe stomach ache. And I was thinking, oh, maybe it's appendicitis or something. And so we had to go and have it checked out. And thankfully, it wasn't anything severe. But, that's a case of like, we're, okay, Alex and I are professionals, but you guys are not. And that's okay. So, kind of in terms of assessing, like, is my child, like, does he or she need mental health care? We want to think of it kind of like how we go for an annual physical to prevent, sorry, there's this really loud helicopter here, to prevent, something more serious happening. I hope you all would just think about that. Like, if you, and the awareness that Alex was talking about, kind of developing that awareness of what is your child's kind of baseline functioning like? What are they normally like? And are there any changes in terms of their functioning, their sleep, their eating, their moods? And part of that is also hormonal. So since, most of you guys are not mental health experts, it's okay to actually kind of, ask a mental health professional, is this reason for concern? This is what I'm seeing. This is what I'm noticing. Or if there's like isolation, social isolation, or relationship issues, maybe there's bullying going on. And sometimes I will say, because of the stigma related to mental health, even your own children may not feel that comfortable talking to you because of some feelings of shame, or may minimize their symptoms. So I just want to say, it's important actually to get in early, to not like wait until it gets really bad, because then it's really hard to treat. It's a lot harder. It's way better if we can help our young people and our children access care. So it doesn't mean that you have to be the one, but yeah, as the parent, you have to be the one um, to maybe initiate that. And so, a lot of times I get these questions like, you know, can you have fellowship with someone who's struggling with depression? Um, but if anyone is saying they're struggling with depression, that warrants professional care. That's the fellowship. The fellowship is find someone who can support you through whatever you're going through, and help you to get through that and cope with that in a better way. Potentially, maybe there's, yeah. So I think that's my main um, the main talking points that I had was just being aware, of, so basically asking questions that are open ended. Just how are you doing today? How is this particular class that's hard? How's your friendship? How are your friendships? How are your relationships going? Just kind of showing curiosity. So, and not kind of shutting them down if they say, oh, it's not going well. Then you want to just say, well, how what's that been like for you? So another open-ended question, can you describe that for me? So not judging our children if they're having a hard time, because honestly, we're all having a hard time. I mean, at certain times. So we have to help our children to either get the help that they need. And later I want to talk a little bit about um, if you as parents need to get help. That's important too. So I'll pass it back to Alex now.
Thank you, Vicki. I want to echo one point that Vicki made, and support it in this way. When the Lord comes back, my physical body is going to be glorified, right? And I'm not going to need to worry about my diet. I'm not going to need my wife's reminders to exercise. Um, and there's a lot of things I won't need to worry about. But until then, we need to take care of our sleep, our diet, our exercise. And if we get sick, or if, for example, I break a leg, we need medical care. I'm going to need it to be splinted to care for my physical body. With our soul, when the Lord comes back, we're going to be fully transformed. There won't be any mental illness. And we are certainly in the process now, but from now until then, the Lord charges us to put away all the encumbrances. The Lord cares for our soul being in the best condition for Him to carry out what He's after. And so, if I were to develop, if I were to come to a juncture where the stressors I'm experiencing is beyond what I can handle, I may need, professional help to splint that break or splint that, development, to really make sure I'm caring for my soul. So I wanted to just echo Vicky. It's important, dear saints, that we adjust our view, that we would just encourage you, if there's a feeling that professional mental health help may be helpful, that certainly you would open up the situation, bring it up in fellowship, but not feel any kind of hindrance to even reaching out to a professional. I want to take a few minutes just to comment on one of the most common problems I'm seeing in my professional work, and even among the families in the recovery as I'm responding to various situations. A lot of parents are very concerned about their children, and rightfully so. And there may be certain behaviors, that we're unhappy with, certain things that have developed that, we feel we need to fix, or we need to discipline, or we need to adjust. One of the most common barriers that I see in my work is that parents and children have ended up on opposite teams of a situation. And what I'm most commonly trying to help parents consider is, how can we find a way to address the situation, but from the same team? And so I use perhaps a common example. I have a lot of parents complaining about their child being addicted to video games during the pandemic. And just feel like, why are they spending so much time on this? And it leads to all kinds of turmoil in the household, right? We have arguments, we have attempts to discipline that, end up perhaps worsening the dynamic between you. We have rifts, coming up between parent and child. Dear saints, it's worthwhile to try and understand the perspective of our young people. And I use addiction to video games because it's a great example. Why do young people get addicted to video games, particularly during this time? Well, number one, with any addiction, we of course have a biochemical response happening in our brain, where we need more and more of something to feel the same amount of pleasure. But conversely, that means that other things in our life become less and less satisfying to us, right? But we also consider other reasons that are contributing to their addiction. In the world of video games, the designers of video games are very good at helping our young people feel accomplished, feel sense of triumph and achievement that perhaps they've stopped getting in other areas of their life. Especially if, for example, their parents are saying, why are you doing so poorly in school? It's because of your video games. Why aren't you doing as well? Your siblings don't have this problem. They start to feel that video games is the only place where they actually get that sense of achievement and self-worth. And a third contributing factor, video games is, for better or worse, one of the most effective ways of distracting young people from their negative emotions. And so oftentimes when when our young people are in a certain state of distress that they don't have the adequate capability to cope with, they perhaps have no one around them in their family to open up to. They haven't had the conversations with their parents or serving ones about this topic. They don't know how to cope. Well, then it would make sense, dear saints, that they would turn to the things that would provide them the most joy, provide them the highest feelings of self-worth, and provide them with all the distraction that they need from all the suffering that's happening internally. Okay, so dear saints, I use that as an example that sometimes, video games is a lighter example, but we have concerns with addiction to social media, addiction to other more serious things, substances, alcohol, pornography, all the different kinds of serious things we see among our young people. And on a psychological level, we often see that there's just an inability to tolerate or cope appropriately with their internal distress that results in many of these behaviors. And perhaps they've gone through certain experiences in their past, maybe some that you're aware of, maybe some that they haven't been able to open up to you. And they're still, they don't have any age appropriate way to cope. And so sometimes we need to really understand the deeper need or pain rather than simply reproaching the behavior. And we often find in our professional work that when we address these underlying wounds, this often reduces the behavior concerns. The Lord is someone that meets us wherever we are at, right? That's certainly my personal experience and testimony. And so this is how we need to approach our young people, right? And if we can take the steps to understand them and their experience and their perspective, it may be easier to enter in alongside them instead of trying to approach things from the opposite side of the field. Before I pass it on to Vicky, I want to make one last observation. Many times when saints are opening up to me regarding mental health difficulties, it's the first time that they're opening up to another member of the body regarding their issue. Okay. And it's not because our young people don't want to open. It's because there's no one that they felt would listen to them without judging them. Right. And this highlights for me one of the most significant obstacles, both in society, but also, and perhaps even more so in the church life, to the proper care and response towards mental health concerns. We are not adequate, dear saints, in our listening to our young people. Actually, in Brother Nee's book, The Character of the Lord's Worker, the very first chapter is on our listening, right? And in this chapter, he emphasizes a key component of being a good listener is our entering into the feelings of others. So even Brother Nee brings up the need to listen with empathy. Okay, so in the field of therapy and me and Vicky's line of work, various studies have been interested in looking at what patients find to be the most helpful part of therapy. We have all kinds of helpful interventions and techniques and skills that we use to treat our clients. But what studies have found to be the most important factor in the effectiveness of therapy, the most helpful part of therapy for the patient, has consistently been shown to be having a relationship with someone that will listen to them without judgment and with empathy. Okay, isn't that something? The most helpful part, even of professional psychological help for the patient, is simply having a relationship with someone that will listen to them without judgment and with empathy. So dear parents, dear serving ones, we need to consider before the Lord, do our children, do our young people feel that we are listening to them without judgment and with empathy? Okay, based on our current trends, the answer seems like no at this time. But if we can advance in our shepherding in this way, I would say that we are already equipped to care for many of the mental health difficulties that are arising among our young people. And in fact, this is how the Lord shepherds us, right? In Hebrews, it says he's been touched with the feelings of our weaknesses. And this is how we receive mercy and find grace. So, dear saints, I hope to just reinforce this burden, the need for us to listen and enter in alongside our young people as they struggle with all the different things that we find that everyone has been struggling with, particularly during the last year. So I'll pass it back to Vicki.
Yeah, thank you for sharing that, Alex. I think that is so helpful to hear as a parent. And I want to kind of address on the parent side, potentially some things that may be helpful, particularly around how we can create this atmosphere in our homes of listening non-judgmentally and of acceptance. I think that's kind of the word that I was thinking of when Alex was talking about acceptance. Of course, notwithstanding concerns about addictive, behaviors, but acceptance of your child. So of their pain or whatever they're going through that may be driving them to these potentially destructive coping behaviors, and that factor of listening is just such a big one. And I want to kind of talk about on the parent side, what that can bring up for us, for you guys as parents and serving ones, may also be pain. And for that reason, you may instinctively shut down and not want to hear their pain. And that interrupts, this creating this atmosphere of listening and not judging and acceptance. And so I want to talk about how can we as parents regulate ourselves and know that actually that it's much better. It's much better for both your child and for you to know about the pain and to hear it and to enter in and to be in it together. And so we as parents need to kind of model that it's okay, that it's acceptable to have pain sometimes, and that we just take care of it. So an example I'll use is like, if you're walking with a small child and the child trips and gets a little scrape and is, kind of starts crying and having a meltdown, and you say to the child, well, that's not a gash. We don't need to go to the hospital. What are you crying for? What's the big deal? What will happen to that child is more pain, like emotional pain, and it's not going to soothe that child. But if you kneel down and you say, oh yeah, ow, that hurts, that looks like that hurts, let's take care of it, right? Let's wash it off and put a band-aid on it, and then we can keep going. That is attending to the pain and managing it so that it becomes tolerable. Okay, if you try to just dismiss it and ignore it and pretend it doesn't exist, it's going to get worse is what happens. And it turns into shame that's toxic. So what we want to do is acknowledge the pain. So and that may even look like maybe on our side being a little like vulnerable, like I had a hard day at work, or sometimes I'll tell my kids, I had a rough client. It was just rough, but and then they just kind of say, oh, sorry, that happens. Yeah, I had a rough day too. That's totally acceptable. It's okay to acknowledge that we have our struggles too. I just want to, say that we as parents are models. We are their models for what is okay and what's not okay. So if we never talk about our struggles. Of course, you're not going to be like, you know, treating your child as your therapist. So part of this is recognizing, you know, when you as a parent need to get help yourself. So in other words, if you have like notice in yourself lots of irritability or panic attacks or trouble sleeping because of anxiety or whatever, though that's the time where maybe you should go and get yourself some help. And also parenting, I want to say, is like such an it's an undervalued job in our society. It's so there's not a lot of support kind of, you know, it's not required to graduate from college. You don't have to take a parenting 101 class. It's like it's almost like remedial if you have to go take a parenting class, right? So, but actually, you know, think about your own relationship with your parents and were you happy with how, you know, how that was? If not, if you're not close to your parents, if you weren't, you know, you didn't like how you were parented, guess what? You probably need to get some parenting help, and that's okay too. So I just want to, you know, if you want to develop that kind of relationship with your child that is maybe different from how you were raised and the relationship you have with your parents, then you're going to not just need to know what not to do, but what to do. So you can't just say, well, I didn't like that my parents did this with me, so I'm not going to do that. You need to know what should you do? Like what is the thing that, you know, will create closeness, for example, if that's a goal. So anyway, just want to say it's just like the, you know, the airplane thing where you're like put the oxygen mask on yourself and then you can put it on your child. That's what we're talking about here, is take care of yourselves so that you can take care of your children, and they will see that and realize, oh, it's okay. It's okay, you know, to ask for help. If we don't model that, they're not going to get that message. If we're just pointing at them and saying, you need help, you know, I'm going to help get you to fix you, that's not good. They're just gonna, you know, say you don't get it. So we want to model this for them. Okay. Um, let's see. I think now we can go to question and response time.
All right, yeah, if anyone has any questions, feel free to either write it into the chat to everyone or to me specifically, and then I can ask the question on your behalf. So I did receive one during the course of the conversation. I'll read it slightly paraphrased. So one serving one asks, one of our YP's parents went through, or one of our YP went through, I'll just paraphrase, went through a tough situation. And this pandemic really affected her and her school. I heard a rumor that she dropped out from school. But when I see her, she didn't mention anything about dropping out of school. She says she is having a hard time, but she doesn't seem to want to talk about it. It seems she wants to brush off her current condition. As a serving one, how should I take care of her? Should I wait till she opens up? Should I initiate a conversation with her? What would be and if so, what would be a good way to start the conversation? I don't know her parents, and I don't think her parents are meeting anymore.
Well, I can perhaps provide an initial response and then appreciate any insight that Vicky has. A few things come to mind, and I'm glad Vicky called this a Q&R time. I think that means that we might not have all the answers, but we certainly can do our best to respond. You know, the mental health of our young people, and as serving ones, I hope you hear this. Sometimes as serving ones, we feel obligated to take on the role of their parents or their family, and please don't misunderstand my heart here. Of course, we need to love and shepherd our young people, but the adequate care for a young person's mental health, the one of the most important factors is the family dynamic and the family system. And so for us to try to care for a young person, um, and any kind of mental health concerns that they may have, independent of their family unit or system, typically we don't make a lot of progress, right? Because there's only so much time we spend with them. There's only so much of a relationship we have. Um, the majority of their time is spent at home with their family, and um, so from my perspective, I think it's important to consider how we could perhaps coordinate with the family to ensure that our young people are okay. And I hear, this comment in the question. Well, I'm not sure the parents are meeting. I don't really know them. Dear saints, perhaps that's a concern if we're talking about some kind of spiritual, situation. But when it comes to mental health, you don't have to be in the church life to be concerned. And I'm sure for the most part, regardless of their spiritual condition or their participation in the church life, they care about their children. And a matter that would be this concerning, that they've potentially, dropped out without anyone's awareness, and maybe struggling with significant, difficulties, um, certainly warrants contact with the parents, regardless of thoughts about whether they're in the church life or, your relationship with them. Um, I do think that most parents would appreciate, some kind of warning, or would want to know if outside of their awareness their child had, significant difficulties. And perhaps you'll find that once you've kind of come into coordination slash fellowship with the family, that it's much easier for you as a serving one to be a lot more effective in your care and shepherding, specifically for mental health difficulties. So that's perhaps just a general response. I think the question may have been more specific, but the way we reworded it, I think perhaps it's more general. So I mean that for any kind of mental health difficulties that parents might not be aware of, or that we may be concerned about. Um, not just the matter of dropping out of school. Vicky, perhaps I'll pass it along to you, but perhaps something you could touch on is also related to the question of how to care for the young person directly.
Yeah. Well, I just would definitely amen what Alex said about contacting the parent, whether they're in or out of the church life. We did have a case where one of our serving ones came to me because she went on I think it was a junior high retreat with some of the junior high girls, and one of them was like showing pretty disordered eating, like some spontaneous or eliminate, like throwing up of her food, and was really trying to dismiss it. And the serving one came to me, and I just did tell her the same thing, that you need to go to the parents. And there's a language barrier. Anyway, so I had to get a translator and stuff. But it was, yeah, it was like that serving one really wanted to kind of handle it herself. And I was like, no, no, no. This is a minor. You need to go to the parents. That's the safest thing to do, actually. So, and then I'm sorry, Alex, you were talking about, oh, how to care for the young person directly. Well, I think yeah, it was, who had told, sorry, it was a long kind of vignette there, but like, if if the young person doesn't want to open up specifically about that, but the serving one is noticing that they're kind of having uh, just seems to have a low mood or something, the serving one can just kind of reflect that and just say, hey, I'm here to talk if you ever want to, just kind of offering that offering themselves as a resource. Or, yeah, I think just being a safe person to talk to is really good. So not necessarily pressing or saying, hey, I heard, from so and so that you're not going to school anymore. I'm not sure, yeah, if that would that could be the case where you are, um yeah, you are confronting, because there are some safety issues there. Like if the child is pretending to be going to school and not be going to school, where is that child? It's actually technically illegal for them not to be in school. So I would have some safety. Yeah, maybe that borders on safety issues, where it is warranted to kind of ask the child, hey, what's going on? How old is this child again?
Um, I'm not sure where there was an
Okay.
age here. Yeah.
Okay. Yeah, Alex. Sorry, I was kind of talking through that out loud, or thinking about that out loud. Yeah. Yeah, that is definitely a concern for safety issues. Yeah.
I think Ben, you mentioned we have additional questions.
Yes. Another question is, what are some mild and severe symptoms that point to a mental health illness?
Um, I can certainly start. Um, so it's a good question, and maybe something I would just clarify. Once we're in the category of mental illness, that means that we're no longer mild, right? And I think that's inherent in the definition. Um, just like my physical health, if I'm sick, if I have mild symptoms, then maybe I need some routine care or common treatment. But once I'm medically ill, it's now become severe. And so it'd be the same with our mental health. Um, I'm sure everyone on this call has experienced negative thoughts, emotional distress, maybe difficulty being motivated to do things. There's all kinds of ways that our mental health is impacted day to day, which is quite normal. But once we're at the situation where we are crying every day, we are having all kinds of negative thoughts that we can't get out of our head. Um, if we're so anxious that we can't stop worrying, our body feels anxious, we're having panic attacks. If we can't function properly, if we can't, go to school, if we can't hold a job, if we can't attend attend the meetings or attend things that we usually would want to attend, um, that would also be an indication. So I would just kind of highlight the two principles there. One is there a significant amount of distress? And two is our typical functioning impaired in some way? If you're noticing that either of those things are the case, that would point to significant concern or major concerns that would warrant assessment for a possible mental health diagnosis or mental health disorder.
Yeah, and I would just include, in both distress and functioning, social and relational distress, or social and relational functioning, which Alex referred to, just in terms of, can you go to social things that you would normally enjoy going to, but you can't get up out of bed, or you don't have the energy, the motivation to do that. So if your relationships are impacted or distressed, or quality is impacted, that's also reason for professional help. Um, yeah.
Amen. I have one more, which is not a question, but more of a testimony. I'm a parent of two high schoolers and one college age. I never thought my children would suffer from mental health until our daughter's freshman year in college, pre-pandemic. She suffered from anxiety related to new corporate living arrangements at college. My daughter tried to reach out to the saints, but they only wanted her to turn to her spirit, and it made her mental health worse. Her mental health progressed with anxiety, and finally, a doctor recommended her to see a counselor. I'm so thankful because it helped her so much and was a lifeline. I'm so thankful that she has received help with her anxiety. I would encourage saints to be open to just listen to the YP/college age without judgment because they need to be cared for humanly. We need to listen in order to find out where they are at.
Amen. I want to just add a comment to this testimony, and thank you, dear parent, that opened this up. You know, sometimes, you know, when you're not in the field, you're not aware, but those of us that are in the field, we have a lot of good treatment for many of the mental health concerns that come up. The problem is that the majority of people who need help aren't willing to get the help, or in the case of our young people, their parents don't feel or aren't willing to get them the appropriate help. I think last I checked, statistically, it's almost, I think it was up to 40% of individuals who need professional mental health care don't go on to receive it, which is unfortunate because we really have very many effective treatments. The majority of concerns that come to us can be treated and can improve. I think there really is just still a matter that Vicky brought up earlier of stigma that exists within society and among the saints. I would just I just want to add an observation, and this is demonstrated even in the professional research, but particularly, dear saints, in society, our Asian and our Hispanic households have been found to have higher levels of stigma related to professional mental health help. And if you fall into this category, you know, maybe you'll have a certain response or reaction to what I'm sharing here. But dear saints, among all the different needs in the recovery that I need to respond to, particularly suicide concerns or risks for suicide among our young people, 99% of them are those that are either Asian or Hispanic. And I think, you know, we're just not immune to the same trends that happen in society. So dear saints, I hope this time also we would just chip away at the stigma that exists and realize that there are significant concerns that are very treatable and that we have a lot of ways to help, particularly the earlier that you start to seek fellowship and you start to seek help. So thank you, dear parent who shared that testimony.
All right, we have 2 questions left. We'll see how much time we have. Hopefully we can get to both. The second to last question is, a poor relationship between parents and children was mentioned as a barrier. What can parents do to fix this?
Okay.
Yeah, I can address this. So I actually have some resources that I'd like to post in the chat for you that I hope can help you to build. So I want you to think about this doesn't happen overnight. There's no magic phrase. It's a matter of building a relationship with your child, and you know there are things you can do. So so that's really great. We did talk about the listening and showing empathy, which means just acknowledging the feelings are valid and not judging them, not saying you shouldn't feel that way, you know, don't be disrespectful. I hear that a lot. It's a very Asian thing, you know, don't be disrespectful. But anyway, and Asians in particular, I will say potentially the symptoms for depression, for example, may show differently. And actually for males and teenage males also for depression, a strong indicator could be irritability. So a short fuse, a short temper. But I'm gonna say, for Asians in particular, there are cultural barriers for seeking mental health help, and part of that, culturally speaking, is the somaticization of mental health symptoms. So, in other words, the physical symptoms that might come out, be an indicator of depression, could be migraine headaches, ulcers, even increased allergies or sensitivities, so stomach upset or aches and pains. Basically, those are kind of more acceptable things, and they're, of course, there are alternative treatments in Asian medicine as well, but kind of knowing that, there are cultural factors that can play into what symptoms may look like. And sorry, I don't know how I jumped onto that. I think I was going backwards. Anyway, what can we as parents do? I'm going to post this in the chat. A couple of resources that I personally find really helpful and professionally. So I hope that's something you guys can just access. And
Vicky, do you have Adele Faber's book on there? How to Talk. So cute.
Oh, yes, that is an excellent one.
It's a book that I'm very
yeah.
recommend.
Do you want to put that one in? Yes, I love that one. That one's excellent. I'm trying to kind of do a chat to everyone, but everyone publicly. So someone direct messaged me. Oh yeah, there we go. Okay, yeah, you put that one up. That one's so good. It's both for younger. There's a version for younger kids and one for teens. So whatever age range your child falls into, that one's a classic. And I would just say this blog I find really helpful.
Well, Vicky's posting that. I don't know, Ben, if you want to read the last question.
Okay, the last question is actually fairly specific, so I'm not. We'll see what can happen. My son has some issues. We saw a psychiatrist at Kaiser, but it didn't help. My son was not open, and the psychiatrist didn't really care either. Does the panel happen to know any saints who are psychiatrists working at Kaiser?
I do not.
That's
Kaiser's,
specific. I don't believe, I have a pretty good knowledge of all the saints who are in the field, and I don't recall any of them being Kaiser specifically. But perhaps a way that we can maybe make this question more applicable to everyone is just speaking a little bit about the best way to seek help. Typically, I think Vicky would probably agree that what we're typically recommending is one of two avenues. Either one, you start with contacting your insurance or contacting your primary care provider, and open up your concerns, and perhaps they would be able to give you a referral that would work with your insurance. And there is a website, Vicky, perhaps you could put it in the chat as I'm speaking, psychologytoday.com, that I'm often recommending to families. It's the most extensive database on the internet of mental health providers. And you can actually search by your child's age, by your location, by your insurance. And a lot of providers are on there, and they have descriptions about themselves, so you can see if they'd be a good fit. The most helpful mental health provider would be someone that's a good fit, with your child. I think that's the most important thing to look for. And so sometimes we have negative experiences where they're not a good fit, and I would just encourage you, saints, that doesn't mean we discontinue persevering to give them the help that they need. It really only takes one good experience to get your child the right help. And so regardless of how many negative experiences that you may have had.
And I just want to follow that with, I think both Alex and I get this question a lot of, do I need to find a Christian therapist, or I really want a Christian therapist? And we just would say beware of that. Sometimes people will advertise themselves as Christian counselors, but they're not actually licensed mental health professionals, meaning they didn't get the training that is actually needed to provide adequate and effective treatment. So making sure, someone may advertise as a Christian therapist, or a therapist who can integrate faith and Christian things into their treatment. But for our children, basically, we're not demanding that our physicians, our medical doctors, have, or our nurses who care for our physical person, be Christians. So it's kind of similar. I think this is important to realize that anyone who is a trained professional, most of the times we're going to these people not for faith issues, but for psychological issues. So just kind of encourage you to go with whoever you can stick with, financially speaking, what's doable for you. And if, that's going through your insurance, that's where you should start. Not making that a criteria for treatment. And then I also did put in here openpathcollective.org. This is a directory for therapists that I'm part of, but it's kind of a directory for uninsured or people with not adequate mental health coverage in their insurance. So sometimes Kaiser actually someone with Kaiser coverage can fall in this category because of they're pretty strapped in terms of providing mental health care. So that could be an option for Kaiser people, or for students, for example, college students, some of our young people.
Wow, thank you guys so much. I think we'll end our time here. We're a little bit over. Thank you so much, Alex and Vicky, for sharing. I'm not a parent yet. I found this really helpful. I am a serving one, but yeah, thank you, Saints, so much. And thanks everyone for joining. I hope, we can receive the fellowship, and I know it was helped a lot. So yeah, thank you. We'll end our time here. The event, there'll be another session on Lord's Day, 5 to 6 p.m. That will be with the young people. So hope to see many of you guys there too. Amen.
Okay, thank you.
Thank
Bye.
you. Thanks for the opportunity.